Dr. Richard Buckley, MilfordMD, live again. Remember, this morning's project is some harvesting of fat for fat transfer to the face and hands, which I may show you a little later, and also then some LipoSculpting to further define, youthful, curvy contours, and then some vasoring under the skin to get some additional leveling and tightening, and then a tummy tuck abdominoplasty, which would then make it a lipo-abdominoplasty, and then the fat transfer. I do often like, for small volume transfers, such as to the hands and the face, to harvest some by hand. I have a bucket up here, so we'll do a bunch of harvesting into the bucket, just as a quicker thing. But it's nice just to do some like this. And our patient's awake, as she was in the video just before this, right? You're awake?
I'm awake.
And how comfortable are you?
I'm very comfortable.
Like 100% or?
Yeah, like 100%.
Okay. It's a good percentage, right? One does not need to be out and maybe sickened from anesthesia, to do these kinds of things. Like this type of tummy tuck, like fat transfer, like liposuction. One could just continue around and then it becomes circumferential all the way around lipo, also known as lipo 360. I think people make a mistake and they think, okay, so I heard about lipo 360 and so I know what that is. That's all the way around. But it's all artwork. It all requires some experience, and lipo 360 is going to be not the same at each place. It's going to be different at every place, based on the artistry, skill, experience of whoever is doing it. And while things might look simple, there are things to know, and it's not entirely simple. Even in this case, as simple as deciding, what little tool I have here to withdraw the fat. I actually like this little tool. It's called a Sattler. It's named after Gerhard Sattler in Germany. It's a nice little tool. So, thank you for watching. MilfordMD. Try and get back to you a little later.